Now get this. Every 10 minutes in the United States, someone is added to the National Transplant list. That's according to the U.S. Health and Human Services Agency. And there are not nearly enough organ donors, living or deceased, to address the critical demand for organs to help those who need them. Iya Bekondo, a transplant recipient originally from Cameroon and founder and CEO of the Iya Foundation, says there is a need for greater awareness in the Black community, and more Africans should understand the need to become organ donors. Take a look.
I am a kidney recipient, and my kidney is going to be 13 years old. My mom gave me a kidney, so it's of particular importance for me to acknowledge and celebrate that every time. For me, it shows my gratitude. I want to also use it as a platform to inform my community and sensitize my community about organ donation.
As an organ recipient, what can you tell us in terms of the availability of organs, kidney in particular, which is what you had to deal with?
Simply put, organ donation saves lives. And for organs like kidneys, where you can share your spare and still live a comfortable life, an uninterrupted life, a healthy life, I think we can get away with sharing a spare, and it goes with other organs, even like your liver. You can donate your liver and it's not going to affect your quality of life at all.
So what are some of the common reasons that people give you when they refuse to become an organ donor, especially in the African community?
As simple as, I just don't want to tamper with my body. If I'm going to come back to this life again, I want to have everything intact. Those are the most popular ones. Now, some people have this religious reasons. My religion does not allow me to donate organs and stuff like that. And which, of course, almost every religion right now, at least that I know of, all religions are very accepting of organ donation.
So how do you make the case then?
In my community, I use myself as a point of contact. My kidney has been 13 years old. My mom gave me a kidney, okay? And my mom is going to be 71, 72. When she gave me a kidney, I'm sure she was, in her 60s or late 50s? And she has had no health problems as a result of kidney disease. Nothing. And I know many, hundreds of thousands of other people who have no issues being a recipient or being a donor as a result. Now, granted, there are people who have their own, everybody's an individual. You might have your own health problems that may come along the road, but hardly is it ever because you donated an organ or because you were operated upon. And there's risk with any operation anyway, so there's risk. And the thing is, the prevalence of something like chronic kidney disease in our community is skyrocketing. More and more people are going to be diagnosed. More and more people are going to get sick from kidney disease. The number is only escalating. So and diabetes and high blood pressure are the two leading causes of kidney failure.
Moving forward, what would you like to see? What would you hope to see?
What I would hope to see is that we become more accepting of organ donations. I want our community to be more welcoming of the idea of being organ donors, because like I said earlier, Blacks especially, we are twice less likely to become organ donors, but we are way up there on the transplant wait list. That's because we are not donating. Also, I would like for us to be more health cautious. I know it might sound cliche because we've heard it so much, it's something that it's always in our ears and stuff, but there are certain things that we can change our lifestyles. I speak as an African, and I know some of our lifestyles, you know, and I think little tweaks here and there, eating less salt, we love our salt, eating less salt, eating less palm oil, you know, the carbs, the alcohol, we love our alcohol, beer, you know, and exercising more, you know, reducing your cigarette, you know, or eliminating if you can, you know. So just those little tweaks here and there. And personally, my thing is, we can do anything if we do it moderately. Sometimes we do it in excess, and that's when it becomes detrimental to us.
And before becoming an organ donor, one has to check with their medical provider to ensure that they are suitable candidates. And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Vincent, back to you.